Hi, I'm your host, Dr. Roddy Raban, here on Plastic Surgery Uncensored. I'm super excited. On this episode, we're going to have Dr. Michelle Hakaka, who's a world-renowned OBGYN. We're going to be discussing everything you need to know about pregnancy, before, during, and after, in order to get the best cosmetic outcome. So make sure to join us on this episode of Plastic Surgery Uncensored. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. I'm super excited about this today's episode. I'm very lucky and honored to have a dear friend, but more importantly, an amazing colleague, Dr. Michelle Hakaka, on with us. She is a world-renowned obstetrician, gynecologist, OBGYN, and I brought her on because I think it's really important. As many of you know from listening to our podcast, a big part of what I do are so-called mommy makeovers, which basically is the cosmetic reconstruction of a mom who's undergone pregnancy. And many times patients come in and there's this huge dialogue about, gosh, I feel guilty. I should have done this differently. I wish I had known. And I think Michelle can allude better than anybody about the elements of pre, during, and post-pregnancy that you actually do control and will have an impact. And perhaps those that you don't have a control and you shouldn't beat yourself up and are the inevitabilities of the transformation of having children. So super excited to have you. Michelle, welcome.
Thank you. Thanks for having me.
Of course. So Michelle, why don't you give me a little background of who you are, your type of practice, and sort of, I refer to you as one of the more patient-centric OBs. Obviously, you take care of my family. I can't say you take care of me, but you would take care of anyone that I love. And the reason is not because I know you, it's because I know you're outstanding. And by outstanding means that you put patients first. And so tell me a little about your practice and your training and all that good stuff.
Okay, so I grew up on a tiny island, Maui, and decided
I've heard of it.
Some people have decided to come to LA to do all my training with the full intent of moving back to Hawaii, and ended up staying in LA and have been in practice. This is my 19th year in practice.
19th? My God, you look 12. You've been cheating on me going somewhere else getting plastic surgery.
That works out. And I have, I've been really lucky to be able to build a practice where I can spend a lot of time with people. I love 99% of my patients. I am there the entire time they are pregnant. I deliver, if not all, mostly all of my patients. And I don't think I could be the type of doctor that just rushes through. So I like to sit and explain and have a dialogue and educate and really make sure everyone is happy and educated throughout their pregnancy.
Yeah, and I think you touched on a couple of things. The people that we have on the show are people that resonate with the same philosophies that I hope that, I exude when I'm in my practice, which is this balance between trying to be efficient, which obviously we do today, but really finding the old-fashioned nature of there's just no substitute. You can't rely on Instagram, you can't rely on websites. You gotta explain, and the transparency of the dialogue with patients. And I think you do an amazing job of that. And that's sort of the secret sauce of success today, which is interesting because what makes you and our friends and the people we work with great is that they are relying on the basic principles or the traditional aspects of medicine rather than some of the more modern aspects, which is old-fashioned care. So I know that you've always been in the forefront of pushing so-called patient advocacy, meaning you're trying to do what's best for the patients while obviously maintaining the highest level of care. I know you were one of the first OBs who started to recognize that patients who get C-sections, because I see tons of patients who come to me for tummy tucks or even C-section revisions who are so unhappy with bulges and irregularities and all that other stuff. And I know you were one of the first to really push the idea that, hey, we don't have to make some ginormous hole up and down a woman's belly in order to get a baby out safely and healthy. We can care about the mom wearing a bikini in 6 months. And you can't just say, hey, listen, the baby's safe. What are you complaining about? You're alive. So tell me about sort of what drives you to make the so-called Michelle Hakaka incisions.
Well, I mean, first of all, as you know more than anyone else, patients don't care about what you do on the inside. All they see is what is on the outside. So I can go through 8 layers and get a baby out and sew everyone back up. But if that scar is not ideal for them, then they're going to be unhappy. So the reality is, it's easier for us as surgeons to get a baby out of a big incision. And historically, those incisions were, hip bone to hip bone and a little bit higher up than they are now. But the reality is that if I can get a baby out through a 10 centimeter incision, which is typically the diameter of a newborn's head, she's going to heal faster. It's going to be lower. She can wear a bikini. She won't even see it with her underwear, and she's going to be really happy. So we struggle a little bit more, but the patient does so much better.
So that again highlights what we've echoed multiple times on the show, which is just because it's not as easy for you, but rather better for the patient, doesn't mean it means that you can do it. So a little lower, a little smaller doesn't compromise the outcome. Maybe you have to work a little harder, but the net effect is that you've done so much more for your patient. So it obviously is easy to just make it bigger and larger, and boom, the baby comes out and you don't struggle and you're out and you're on to the next case. So that just sort of sets the background in terms of who you are. And the listeners can then understand why we were having this conversation. So I see patients day in and day out, some of which are mutual patients and some of which are just people from around the world who for whom their changes they underwent from pregnancy is really the reason they're there. They're super fit, they're super in shape, they breastfed 3 beautiful children, and now they have so many changes that their bodies are unrecognizable and they are very unhappy as a result of the changes. Now, if you love your body, whatever form it's in, high five. But you don't have to be, today you don't have to be a prisoner to that new form, and there's a lot of options available. So what I want to talk about is, from your perspective, watching women before they get pregnant, during their pregnancy, and afterwards, what are the things, let's start to talk about the things that they do have control over in each phase that you think would improve their likelihood, right? The goal would be not to come see me. The goal would be you have your 3 children, 2 children, 5 children, and you'll never look exactly the same, but you look good enough where you're like, I'm good. I don't need to see Dr. Raban. So what are the things that they can do?
So I think that's an important distinction that we'll talk about the two, because there are things that are out of someone's control, but there are a lot of things that are in someone's control. So pre-pregnancy, ideally, you want to be at your ideal body weight. Starting a pregnancy when you are 20 pounds overweight, even 10 pounds overweight, is going to just add to the distortion of what happens naturally during a pregnancy. So I always joke around, and I can say this because I've had 2 kids, that babies wreck us, and they do so differently to different people. So starting a pregnancy in your best possible shape is the best thing I can offer prior to getting pregnant. Now, the crazy thing is that we have 9.5 months and you're going to gain 25 to 35 pounds. So that's a lot of weight in 9 months. If you, Roddy, gain 25 to 35 pounds in 9 months, you're going to distort your body. And that's what we recommend for everyone. If someone is over their ideal body weight or even obese and they start a pregnancy, we still recommend that they gain weight. And that's going to be 11 to 20 pounds. So what happens in those months is not only is your belly getting bigger, but many parts of your body are getting bigger. And women start to notice different things happening depending on how much weight they gain. So women who are gaining 50 pounds, 60 pounds, 100 pounds are absolutely, in that short amount of time, going to end up with stretch marks. They're going to end up with a lot of extra adipose tissue or fat that is really tough to lose. They're going to end up with their fascia, which is that tight layer, that holds everything in for the audience. And that gets distorted, and that's really tough to have that come back. So watching what you're eating is really important.
So point number 1 is that, you're looking for the things, you're about to get pregnant, and you're asking yourself, well, what can I do? I don't want to be, I don't want to end up like my friend or my cousin or whatever. So absolutely 100% your pre-pregnancy, not only weight, which is absolute, but your pre-pregnancy condition is of course going to make a difference of where you end up. If you're 35 pounds overweight before you get pregnant, then you're going to get this baby stretching in you, you can't be surprised that you are behind the 8 ball after pregnancy, which, as we all know, is incredibly difficult hormonally, physically, mentally, emotionally for you to lose weight. So you're stacked, the cards are stacked against you. The second issue is not only the weight you start out, but the amount of weight you gain. So those are two very distinct issues. One is I was 40 pounds overweight, but I only gained 10 pounds. And the other is I was at my ideal weight, but I gained 52 pounds. Both of those are no-nos. And aside from cosmetics, just from the well-being of your child, as you know better than anybody, those are super critical, and you 100% absolutely do have control over it. And so those are really good points. What other things can you control prior to or during or after pregnancy that you think makes a difference?
Other than weight gain, I think just being careful in what you're eating, because that also lends toward the development of gestational diabetes, right? So women who have cravings, and we all do when we're pregnant, I won't even go into mine, but craving really sweet things, gaining more weight, and developing gestational diabetes tends to put more fat in the belly, which then again is tougher to lose, distorts the anatomy for afterwards. And it makes it harder to lose that weight afterwards. And then there are women who are, a year, 2 years down the line, and they still haven't lost all that baby weight, which kind of brings me into my next topic, that then you start another pregnancy and you're 10, 15, 20 pounds more than you were the first time. And then you do another pregnancy. Now you're 30 pounds more than you were the first time. So ideally, you start at your body weight that you find appropriate for you. You gain 25 to 35 pounds. You lose it, not right away. And I always tell women not to beat themselves up over it. You lose that weight before you start another pregnancy, or you're behind the 8 ball again.
Very, very important. It's about, you have control over your pregnancies. It's not immaculate conception. So if you want the best outcome, you need to, like everything else, like an athlete, like anyone else, you need to pace yourself, and you want to be able to get yourself an optimal condition for the marathon. You wouldn't just get up and sign up for the LA marathon and just kind of wing it. Right. You wouldn't, but a pregnancy is a 9-month marathon. It's going to rock your world physiologically. Your volume increases, your weight increases, everything changes. And so if you started out kind of just out of shape, you shouldn't be shocked that you're having, issues postpartum. What is your...
Oh, sorry. I was just going to add in a quick little thing about exercise, that we want women exercising. So when my mom was pregnant with me, it was like, do not exercise. You absolutely have to sit there and just kind of, be idle the entire pregnancy. Now we want women exercising, and there are certain things that we want them to do up until a certain point. So usually I tell women up until 20 weeks, whatever you were doing, keep doing. Even if you were running, you were spinning, these things you can continue doing until you're 20 weeks. And at 20 weeks, when your abdominal muscles naturally start to separate, because they have to, because they're allowing a pregnant uterus to come forward, we don't want you to continue tightening those muscles, because then it's harder for those muscles to come back again, and people end up getting a diastasis recti. So I think that, doing your regular exercise and then modifying it so that you're still active and you're helping with your weight gain will help you lose the weight afterwards, and also hopefully allow your muscles to come back to the midline.
Sure. I think those are great points, because part of it is, okay, well, I don't know how to not gain the weight. I gained 50 pounds. Well, part of it is remaining active. I know my sister was pregnant. My mom was freaking out. My mom is an old generation gal, and my sister was like still going to the gym until her, almost she broke her water. And my mom's like, you're going to drop the baby. And my sister's like, what the hell are you talking about? Of course, you're not going to do super extreme sports, but you definitely need to be active. And if your back is starting to kill you because you just happen to be that person, get in a pool, then do something on the ground. But definitely the last thing you want to do is just allow the pregnancy to ravage your body. And 100%, this I know for a fact, the strength of your abdominal muscles in particular is very, very important in terms of the amount that they tear apart. So just imagine the analogy that you have two redwoods and you're trying to push them apart, those being your rectus muscles, versus having two floppy, two ferns or some really floppy tree, and you just push them apart with greatest of ease. You're absolutely right. You don't want to restrict the growth of the uterus, but at the same time, you don't need the uterus to just Mack truck through your rectus muscles. And so the strength of your abdominal wall, more so than any muscle, is going to really make a difference as far as how well it can resist the damage created. So what about, I hear this all the time. Oh, my breasts, they're this way because I pumped, or I should have breastfed for 3 months rather than 6, versus, I have to breastfeed because of the nutrients. There's a lot of dialogue about the breast and how pregnancy, at least what you do during your pregnancy and after your pregnancy, will impact your need for either an implant or a lift, et cetera. What are your thoughts on that in terms of what we know to be true or what's urban legend?
So what is recommended by the American Academy of Pediatrics is breastfeeding for a year. None of us, I shouldn't say none of us, most of us have a hard time breastfeeding for a year. But I will say that pumping and breastfeeding for up to a year, either one or both, really doesn't damage the breast the way that people say. So meaning that a baby breastfeeding with its mouth versus a pump is not going to do more damage one way or the other. I think if you're breastfeeding for 2 years or 3 years or 5 years, which we occasionally see, that's going to definitely do damage to the breast. But what I see is more genetics and tissue strength. And there are some women who've breastfed 3 kids and they look amazing. And there are some women who have breastfed for 3 months, 1 kid, and they come in and everything's completely distorted and they're really unhappy. So I think more so than abdomen, I think breast tissue is more of an individual genetic issue compared to the belly.
Yeah, and I think that's actually quite accurate. I mean, I see everything from the tail end, so everything's about perspective. You see them from the front end, I see them from the tail end, right? I see, 30 women a month for some type of breast-related issue, and I ask every single one of them, how many kids, how much breastfeeding, how long? And so I have created over 15 years a mental note of what it is. Of course, there's a correlation between the length of time and the number of kids you've nursed, no question about it. But as you alluded, it doesn't necessarily mean it's linear. So you definitely have individuals that are, I would say, unicorn-like, and they breastfed 5 kids for a year each, and they have incredible breasts, and those that did the reverse. And that has to do with the quality of the breast tissue. There are girls that show up in my office at 17 and they need a breast lift. I mean, they've never been breastfed. And there are women that are 65 and whose breasts are incredible. So there is the breast tissue. There has to do with the size of the breast. Smaller breasts, who you get, let me rephrase it, has to do with how engorged you get. Some women go from a B to a C during their pregnancy and get mildly engorged. And some women go from a B to a double D. So you, just like the abdomen is stretching, that woman who produced so much breast milk, she could have, as they said, fed a small village, she's going to have more damage to the ligaments than someone who just inherently didn't create as much volume of milk.
That is completely out of everyone's control,
Correct.
So no way to control. Even if someone gains 60 pounds, it doesn't necessarily mean that their breasts are going to expand to the degree that their abdomen is,
Right. And I think that's really important. So I think those things are really some of the more common concerns. There are women that will restrict their weight gain because they don't want to ruin their abdomen, putting their child at harm. There are women that just choose not to breastfeed because, of course, they don't want to create breast sag, and maybe the not feeding, there's well documentation that breast milk is far superior than any kind of formula you get for the first year. And so the argument that we're making is within moderation, those things are really, sort of out of your control. And you should be able to do what we were genetically designed to do, which is carry a child, take care of him without going all the way to the deep end and letting go of everything and just going for it. We're going to take a quick break, and what we'll do is when we come back, we're going to talk about all the things that you don't have control over, which I think is the vast majority. And I think what this is going to come, the dialogue is, it's going to cut you some slack. And there's a huge psychological barrier that I see on my end, because I see people at the final stages of their dissatisfaction. When you see them, they've given birth. There's still a sort of the chemicals that are making you excited about pregnancy. You've just accomplished this incredible milestone. You have the love of your child. But when I see them, their kids are 5, they're bratty, they don't feel sexy anymore. They're trying to get back to their lives, connect and intimate with their husbands or whoever. And so I get to see that. And then there's a lot of guilt. I should have exercised. I should lose more weight. My friends don't look like this, et cetera. And we'll have a conversation about that. But I think that's really important to see from both yours and my perspective. So you guys better tune in for the second half. We'll be right back with Plastic Surgery Uncensored. Welcome back to Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. I'm here with Michelle Hakaka, Dr. Hakaka, world-renowned OBGYN, and we're having a really serious dialogue about myths and reality of pregnancy as it relates to plastic surgery. And I think we had a really interesting conversation about some of the items that we do have control over. So now let's dive into the reality, which is the overwhelming majority of the things that happen to a woman in regards to then ultimately perhaps needing plastic surgery, you didn't even have any control over. So when you know that's the case, you got to give yourself a little grace. And so, Michelle, why don't you tell me what some of the things that you think have nothing to do with your pregnancy, it just going to may or may not happen?
Well, first of all, genetically, some babies are bigger than other babies, and that has nothing to do sometimes with how much weight gain a woman has during her pregnancy. So I have tiny little women sometimes who are carrying 9-pound babies, and a 9-pound baby is going to create a lot more damage than a 6-pound baby. So based on her genetics and the genetics of her partner, that's something that's out of everyone's control. Twins that are not IVF twins, but spontaneous twins or spontaneous triplets are going to create a bigger belly from a bigger uterus, more of a diastasis, more of a distortion of the fascia, also out of someone's control. And genetically, just tissue and skin and the quality of those two things, I can go in and do a C-section on someone and see rectus muscles that are absolutely gorgeous, and this woman doesn't exercise, and they're completely together and they're really strong compared to someone who is exercising and they're thin and there's a huge gap before I even start surgery. So that's another big thing that, it's not a myth that if your mother had stretch marks, you're more likely to have stretch marks. We see that a lot in families, even in women who are gaining the appropriate amount of weight.
Yeah, absolutely. So it's easy to work backwards for me because I see these people and they come in with the following problems. So let's just knock them out. Like, okay, so stretch marks. Doctor, I didn't put enough cocoa butter on my belly. I was rubbing this particular lotion that I got from East Africa that came from the Sahara. You're going to get stretch marks if you're going to get stretch marks, period. There are women that have literally had one child and they got stretch marks, and there are women that have had 9 children and have not a single mark on them. That is outside of your control. I 100% do not believe there is any cream, lotion, potion that you can rub on your belly that is going to prevent you from getting stretch marks. It is a $1 trillion business, all of which is built around zero evidence. You want to rub cocoa butter because it feels good on your skin? Awesome. But don't think it's going to change your stretch marks. Do you agree?
100%. And I'm guilty. I smelled like a, eucalyptus laden Christmas.
Understandably.
But you fall into these, I have to do this and I need to keep my skin moist. But the reality is it's genetic and it's rapid weight gain. So if you are rapidly gaining weight, your dermis will tear and you will get stretch marks. Absolutely. And if you genetically are bound to have stretch marks on your breasts and your abdomen and everywhere else that's gaining weight, you will.
Yeah. So you got to cut yourself some slack there and don't waste too much money on lotions. Second thing is loose skin. So this is a 2-part element. One part of it, absolutely you control, which is I gained 74 pounds with my pregnancy. And one part of it is you absolutely have no control in that I gained an appropriate amount of weight. I was at a reasonable weight when I started, and I still have a ton of loose skin. Well, the fact of the matter is there's nothing you can do about it. And often patients come into me and they are dejected because they're like, I need to lose more weight. I still have this apron. And the irony is that if you have an apron referring to loose excess skin that's hanging or mildly evident, the irony is the more diet and exercise you do, the fitter you get, the leaner you get, the excess skin gets worse. And so, I see women that are like 5'6", 130 pounds. They go to yoga or Pilates and they're like, you want to kill themselves to lose another 5 pounds because they think somehow that skin's going to go away. And yet somehow they seem to keep getting worse. Yeah, because it's skin. Skin's not going to go away by diet and exercise. So don't let anyone trick you into thinking that. I think that's really important to know as well. DR, the amount of diastasis recti, the amount of gap in your abdomen is also, again, similar to excess skin. So yes, if you gain 75 pounds and you started at 30 pounds overweight, of course you're going to get more DR than if you weren't. But there are women, as you have alluded to, I have many triathletes, many many instructors, Pilates instructors, who are so lean, you can see every muscle, six-pack and all, and they have massive diastasis.
Mhm.
So again, diet and exercise, all that isn't going to change that at all. And I think that's you got to cut yourself some slack. I should have worn a heavier bra. I wasn't wearing my bra all the time. Do you think that's going to make a difference, Michelle? Do you think that they're going to avoid having a breast lift?
No, absolutely not. And, I think what you are talking about is something that most women will do, which is we will retrospectively look back and blame ourselves for everything that happens. I had a miscarriage. What did I do? My breasts are hanging down low. My friends aren't. What didn't I do? And the reality is that most of these things are not in our control. And just to kind of go back for 1 second, the act of pregnancy itself, regardless of breastfeeding, regardless of type of delivery, C-section or vaginal, can cause all of these issues. So even if someone has a baby by C-section, they can have pelvic floor issues later. Even if someone delivers and never breastfeeds, they can have issues with their breasts later because those breasts are going to hypertrophy and get bigger, and the tissue, when it comes back down again, certainly can, cause misshapen breasts. So having a baby in and of itself, getting pregnant and growing that baby, there's no way that anyone is going to perfectly go back to the way that they were before.
Absolutely. Here's another one. I mean, I have so many of these. I can even belly binders. My God, the industry. You and I, what we need to do.
I wish I invested in that.
Yeah, no, forget about invest. Who the hell wants to invest? Let's create. I'll make my own belly binder. God damn it. The Dr. Raban, Dr. Hakaka, get you slim, and we'll get one of our celebrity clients to endorse it. Boom, we're trillionaires. I'm in the Bahamas. Forget this. Are you kidding me? So let me understand this. You give birth to a 9-pound child. You're 5'2". Your husband happens to be 6'4". You delivered at 39 weeks, and your belly is like so stretched out. And so because you wore a belly banded, belly binder, whatever girdle what's the girl's name from, God, I'm so bad. The Kardashians recommended your belly should have snapped back. That's so crazy.
I have a big problem with that. What I tell people is that after delivering a baby, what happens is the baby comes out, the uterus is still at the level of your belly button, okay, right after you have a baby for a few days. And we feel like a bowl full of jelly walking around because there's no longer a hard uterus with a baby inside. So a belly band will make you feel more comfortable walking around. It will make you feel better in your clothing for the first 2 to 4 weeks. It will not make you shrink back quicker.
Not at all. And listen, you know me, I'm a binder freak. I have my own binders. I have these 3 panels. There are definitely instances where binders are adjunctive, helpful in certain things, like when I repair DR and you want to give it a break and let that incision heal without tension. Do I think wearing a binder after pregnancy can alleviate back pain because you're giving reinforcement to the abdominal wall? 100%. But do I think that the torn diastasis muscles that ripped at the peak of your pregnancies are going to just grow back together because you're forcing them? No. So this idea of body, it's like torturing your body and squeezing them into these things, these wraps, it's just nonsensical. And as a result, of course, like everything, it's $1 trillion business with no evidence and no real, I love his anecdotal people. Like, I wore this binder and look at me, I have a 6-pack. Well, guess what? You would have had a 6-pack had you not worn the damn binder. But of course, they're the people who are advocating it.
Absolutely. And additionally, during pregnancy, unlike any other surgery that we're all doing, your blood volume is twice what a normal person's is. You are carrying around so much more fluid that in the first 10 to 14 days after delivery, when you're getting rid of all that fluid, if you're binding up your belly, especially if you have a C-section, but sometimes even if you don't, the fluid has nowhere to go. And so it's going to go down to your dependent tissues, and your vulva is going to get swollen, your mons is going to get swollen, your legs are going to get swollen. It's just, I've seen so many times where women call me and they're, what is this? Like, why do I have so much fluid here? Because you're binding it here and there's no place else for it to go.
I mean, you're creating you're constricting it. I always use the analogy that if I squeeze the hell out of your forearm, your hand's going to get into a balloon. So, you're tourniqueting. It's a tourniquet effect. I mean, if you're going to wear a binder, make sure it covers all the way down to your hips at least. I think those are also common. And I think that unfortunately, you know, moms are vulnerable, such a vulnerable population when it comes to the marketing and, in my opinion, malicious attempts to create monetization of their insecurities and inevitable physiologic changes. The creams for cellulite, the creams for stretch marks, the creams to prevent stretch marks, the creams that are used to get rid of stretch marks, the binders, the belly bandits, there's so many things on the market, if you notice, as you know better than anybody, that are created to so-called help moms with zero evidence, with zero proof. And all it does is actually bury them further down into their own state of depression, because the reality is you use the creams and then you still get the stretch marks. And then there's this heavy guilt. Whereas if you knew there was nothing you could do, you'd almost surrender and be like, well, shit, this is what happens. And then you just manage. But instead you feel like, oh, I just didn't rub enough of it on, right? And so the inevitability is that if you definitely want to be doing diet and exercise. And if you need to the point where you had your diet, you've done your exercise, you did all your parts, and your breasts are saggy, lost volume, and you have excess skin and DR, well, you either A, live with it and accept your body and say, this is these are the war wounds from giving childbirth, or you do something about it. And you live in an era where you can. And you investigate and you do homework and you decide what you want to do with your body. But by no means beat yourself up that, you know, somehow you should have, could have, would have, because that's 90% of it is nonsensical.
And I think that's a good point. I think now, you know, now that I've been in practice, like I said, for almost 20 years, I'm seeing these patients that I delivered 15, 10, 5, 20 years ago, and they're done with their families, and they are no longer afraid to tell me at their annual visit, look at my skin, look at my breasts, what do you think I should do? And my answer is always, what do you want to do? So, you know, if they're unhappy, I think historically women would live with that. Women live with a lot of stuff. We live with not loving the way we look after having kids, but hey, we have the kids and we have a good life, and why should we do something about it? We have a husband, he loves us, whatever. But I think now women are very, very in tune with their bodies. And listen, if you're waking up every day and you're looking in the mirror and you're unhappy, you can do something about it.
Yeah. And I mean, listen, I'm blessed because I'm on the tail end of this transformation. So I see, it's about, 40, 50% of my practice is this mommy makeover related surgeries. And I'm very blessed because I get to see this. It's almost incredible. It's, dare I be, poetic, but it's like the transformation of a butterfly, because I see these women, many of which, who come in, and more often than not, they're supported by their husbands. They love them. They think they're gorgeous. It's never really one of those classic, the danger is now we're moving into the Me Too movement and the love yourself and the feminist movement. Hey, rock on. You love your stretch marks. Awesome. But don't shame a woman who doesn't love her stretch marks and doesn't like the loose skin. That's actually 10 times worse than you guys were before. So to each their own. And I see women that come in because not their husbands make them or whatever, but they just don't like the way they look. We do what was necessary. And I'm talking emotional, physical. They start going from underwear that covered up to their mid-navel to like Victoria's Secret thong, laced underwear. What does that state? That states everything. That states you feel attractive, you feel sexy, you're excited about your own physique. They get remotivated to exercise because now you can actually see what the hell you're doing. Before you did 3,444 crunches and it was hidden behind a mountain of skin and diastasis. Now you got a 4-pack. You start to see the elements of a 6-pack. You can wear a bathing suit with your kids at 4th of July and run around and feel sexy and not feel like you need to wear one piece. I see this day in and day out. I probably had 100 women tell me that they finally turned on the lights. Intimacy and lights. I mean, it blew my mind away the first time, but now it's been 15 years. It's like I finally allowed my husband to turn on the lights. When I got into bed, I used to always make him turn off the lights, or I wouldn't allow him to wrap around and grab my abdomen when we would lay in bed because I hated that. And so I think it's awesome that these things are available. And if you choose to do it, awesome. And if you don't think it's necessary, awesome. But know what you don't do and don't have control over. And it takes actually OBGYNs like you to have that dialogue to empower them, to educate them, because often they turn to their OBs for a little bit of guidance. And I have had OBs that were very anti-plastic surgery, and I'm not saying you are pro or anti, but you are, you educate them. And it's kind of like you're almost like they've done this journey with you. And so they turn to you for like, almost like, is it okay? You're like, sure, if you want to do it. No, yeah, why not? I think that's awesome. And I know your journey with your patients is very tight. And so you and I are intimately linked. It's just because we're at different phases of a journey of a woman's life. So, I love working with you, and you and I work together. I for me, when I work with you, it's like kid in a candy shop. I'm almost like I'm off on parole, because I work in an operating room alone with nobody, and you're in a hospital most of the time with like nurses and techs and other OBs. And I come in there and I'm like, Chatty Cathy or whatever the hell it is, because I'm just like, oh my God, hi, you guys hang out.
Well, and also you love seeing the baby come out too. That's your favorite.
I freak out. It's unbelievable how much I freak out every time a baby comes out and I'm in the room, because I do some of the closures and I'm like, oh my God, is it okay?
The running joke is I can get a baby out faster than you can close, a centimeter of skin.
That's true. Listen, I got to substantiate my very existence. I can't do it any faster. Otherwise people will be like, what are you doing here? But I must give you this credit. And I'll end on this. And one of the other things I love about you, and I think about working with colleagues, is you're never too arrogant. I would consider you one of the more prominent OBs in our city, and arguably our city is in the forefront of our country. And yet you have always been open to dialogue about the improvement of your own craft. And what I think is interesting is that a lot of OBs alienate their patients because they're reluctant to understand that you are a phenomenal OB. You deliver babies, nuchal cords, shoulder dystocia, blah, blah, blah. But you perhaps don't do the best job at closing, or you're not sure. And maybe if you talk to your plastic surgeon colleague, they'd say, hey, you know what? Maybe using cautery at the dermis level is probably a bad idea. Maybe if we release the fascia, you'll be able to close it without creating a lump. And what I think I love about you is that, aside from the fact that you're open to having your patients, if they request, you don't get offended if a patient of yours says, hey, Michelle, I think the world of you, but do you mind if I bring in a plastic surgeon, myself or whoever? You're like, sure. That's number one. That says so much about your ego, because more often you're like, wait, I can close your incision. For God's sakes, I deliver your baby. The second is when you and I are together, you're there not just kind of like hanging out, but you'll ask questions and I may make a suggestion or two, and you will consider incorporating it if it makes sense to you. And I hope as a result, I believe that you'll see some, and that just says volumes about you as a physician. So kudos to you in that regard.
Thank you. No, and you're right. And I do. And just like some of my old professors, I hear their voice in my head when I'm doing certain things. I hear your voice in my head every time I do a C-section, and every time I don't use cautery at the level of the skin, and every time I build up the subcutaneous tissue so that there is no traction on it and there is less tension on it. And so thank you.
Yeah. Well, I mean, just being there is a fun and honor for me, and I'm so happy we work together. I mean, I think this was a great episode. It's always a pleasure to speak with not just colleagues, but people that are really intelligent and really pushing the envelope. And so we're grateful to have you on the show. And I'm sure there's going to be opportunities where people ask and call in and things like that. So as always, I like to exit with, tell the listeners where they can find you. Not that you need any more patients. You won't even see me, my family. Where do they find you? What's your, where are you located?
They can find me, information about me on my website. If you are someone who lives in a different part of the country, you can buy my book, Expecting 411. You can read all about things I would say during pregnancy.
So website is what?
Website is michellehakakamd.com.
Michelle Hakaka. We're going to spell Hakaka.
It's a tough one.
Hakakha. Dr. Michelle Hakaka. And the book, you've written 3, right?
No, I've written 1 in a series of 3.
So, 1 in a series of 3. What's the name of the book?
Expecting 411.
Expecting 411. I mean, I read it when I delivered, and it was amazing. No, it's truly a fantastic book, and you've done a service. And then, those are 2 places that you can find her and learn about her, and She's an amazing OB.
Thank you.
Well, thank you for joining us on this fantastic Saturday afternoon. We look forward to talking to you again.
Sounds good. Thank you.
That wraps up another episode of Plastic Surgery Uncensored. Make sure to tune in next week, as I'm sure whatever we're talking about is just as interesting. This is your host, Dr. Roddy Raban.